Hello, I'm Dr. Brandt Gibson, and I had a good friend of mine actually ask for a discussion about plantar warts, Verruca Plantaris. And I'm sitting there going, oh, well, let me just tell him what video I've done that did that. As I was going through the videos that I've done for the last 180 days, I realized that I've never done one on plantar warts directly. I talked about warts and I mentioned plantar warts, but I've never done plantar warts directly. So I'm going to do this discussion of plantar warts in that same fashion, the 4 questions. Number 1, what are plantar warts? Plantar warts are actually warts that are on the bottom of the skin, the plantar surface, the bottom surface of the skin, of the foot. Now, plantar skin, or the bottom surface skin, is thicker, which makes it a little bit harder to treat. And that's why plantar warts are a distinct problem, not just warts in general, or verruca. Verruca is the medical term for warts, and it's just it kind of describes the appearance of what the wart looks like. So the other part of that, of what a plantar wart is it comes down to understanding what a wart is. A wart is an infection. It's an infection of the skin with a virus that causes a deformity or a change in the skin. The skin actually gets to the point where it has little bumps on it. You cut the bumps off, and you get little, what looks like seeds in it, little capillaries that are bleeding, so it gets an abnormal looking skin area with black dots in it, or what people will call seeds. And that's a plantar wart. Number 2, why does it happen? The truth is it's an infection. So the easiest way to get an infection in the skin is to have some kind of injury or some kind of a problem that way. But if you get the virus in the body, you can actually produce warts anywhere in the skin, including on the bottom surface of the foot, which is the plantar surface for plantar warts. Number 3, what can you do for it at home? What are the things that you can do to treat the plantar warts? There are several things that have been shown to be effective. The truth is, if you do the research, you look at the studies, they say that somewhere between 3 to 5 years, warts just go away. Now, that's not always the case on the bottom of the foot, because you're walking on them and you're injuring them, and a lot of times will cause them to get worse or progress over time, so they don't actually go away in those 3 to 5 years. So most people are looking for things that they can do to treat them. And that's kind of where you're probably at, or you wouldn't be watching this video. But the idea is there are over-the-counter type products, salicylic acid. There are kits so you can freeze them. Most of those things are very ineffective on the bottom of the foot because of the thickness of the skin. You can't do enough freezing, or you can't do enough burning to actually fix the problem. And that's the same thing if you go to the doctor and they were going to freeze them or burn them or that kind of a thing. A lot of times it does not work on the bottom of the foot. One thing that does work is duct tape. Now you can actually put duct tape on, so you can put duct tape on that area. And if you can put a big enough piece of duct tape on, you can put it on. You can leave it on for 3 to 5 days. Then take it off, clean the skin, put it back on, and leave it on. Showers, everything, for 3 to 5 days. And over a period of time, usually months, of doing duct tape, the warts can go away. We don't know the exact mechanism. One of the theories is that it interferes with the oxygen to the cells and the tissue there. One of them is that it may be the adhesive in the duct tape. But either way, this is usually effective, but it takes a long time, and you need to basically keep duct tape on it. Number 4, when should you go to the doctor? The truth is, if they become painful and they become problematic and they're not going away, then a lot of times you can go see a doctor and actually be evaluated and treated for it. The most effective thing that we have found in my office for doing this is to inject these warts. The injection that we use is an antigen to Candida. By injecting this Candida antigen, it stimulates the immune system to recognize the virus. So what it does, it draws the immune system to the area. Then it recognizes the virus, fights off the virus, and over a period of 4 to 6 weeks, typically the verruca will go away. And it a lot of times will solve the problem other places as well. So it won't just solve it in that one area, but you can inject a single wart and multiple warts will go away on the other foot, on the hands, those kind of things, and it is very, very effective. Some individuals will get scheduled, and you actually cut them out. Like I said previously, if they're going to freeze them or burn them, a lot of times this is ineffective on the bottom of the foot and just causes wounds and sores and long periods of trying to recover with the wart just coming back. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 180. Plantar warts, Verruca Plantaris. Like I said, if you get to my office, we would usually inject them, and they will go away in a period of 6 weeks, typically. This is Dr. Brandt.